Okay, hi. We're with Jo and we're working on a horse Tara, 19-year-old, and she's got a few aches and pains, but I just wanted to show you some specifics on how to do the technique. So we're going to work in the beginning on the withers area, and I'm just going to show you how I do both sides at the same time. Okay, so I create a claw like that, and I'm looking for the front of the withers, and I'm going down about 4 fingers down until it goes into a groove. And then what I'm doing is I'm squeezing both sides and then doing a bump forward. And it's at that speed as well. So it's quite a good squeeze and a bump forward. And if there was tension here from the lower neck and shoulders, there would be a ripple effect going down the skin. So that's a good assessment to do, and you can do this assessment as the first time you get on the horse. So then you can jump back and do it on the next vertebrae, jump back and do it on the next one. And you see there's no reactions going down there, so that means there's no tension in the withers, so that's really good. And we can extend this to go all the way back to check the back and down to the hips. So we're getting a little bit more reaction, there's a little bit of tension mid-saddle there. So we're going back all of the way. And this is a good assessment when you're starting off your treatment. I'm going down through the hips and finishing off at the top of the tail. So then we're getting good feedback then. For now, the area that I've been working in is the mid-back area, just to get rid of that little bit of tension that was there. Okay, good. Okay, we're back with Tara again, and I'd like to just talk you through the checking for the neck and tension in the neck. So we can check the base of the neck and the top of the neck. If you check at the top of the neck, just at the back of where the bridle strap goes, you see the top of the muscle there, we can do you see where I've got my thumb going down and forward, and I'm just going over the edges of the muscles there and seeing for any unusual reaction. So that wasn't a painful unusual reaction then, so we know that that is nice and free from tension on the top of the muscle. And then there are trigger points going all the way up the brachiocephalic here, so they correspond with the vertebrae going up. So we'll go just to the top of the shoulder, feel for that brachiocephalic there, and do some squeezing moves. It doesn't matter whether it's with your fingers or your thumbs, just to see if there's any tension reaction in the horse. So what we're doing is we're doing a press in with the thumb and a switch down at the angle of the shoulder, and we've got a little bit of tension in there, so we need then to work out that tension. So to start with, I use the palm of the hand and just to warm up the area. Yeah, okay. And you can use your thumbs to do that as well, to warm up the area. And then if we can find a specific trigger point, then we'd use the point of a thumb on the trigger point, which will be a little lump, and then do a constant pressure for between 20 seconds and a couple of minutes until you feel that knot just dissolving away under your thumb. Okay, thank you. Okay, we're looking at a different technique now with the tips of the fingers. So if you've got a muscle like the triceps muscle here, if there's tension in it, the way to release the tension is to get your fingers around the muscle. There'll be 2 separate muscles inside it. Get your fingers around them and do a switch out. So it's like you're bumping the muscle, and so you okay? There's a little bit of tension, there's a little bit of pain in there, so we're getting a reaction. So if you're getting a reaction like that where they're lifting the leg up, it means you're going a little bit too firm, so going a little bit softer. In fact, I'm going to warm the area up a little bit. So on the triceps, if you use the palm of your hand and just go down the muscles, Just warm the area up a little bit. And then we'll get the fingers in the forefingers and then do an outward switch. And that will release the tension on those muscles. So just keep going for 30 seconds or so until it all goes softer and the tension leaves the muscle then. So you see I'm getting the forefingers in there and going around the muscles and I'm switching, bumping out. And we're going to do it up the whole length there. Okay. So work your way, it doesn't matter if you work your way up or down until it goes nice and soft like that, and then the tension's just gone. Good? Okay, so I just want to show you, and underneath where the transverse pecs are, you can get a lot of tension up here, and it's something that's easily missed on a horse. So feel around for any tension and lumps, and this is lovely and soft with tar here, but if it isn't soft you can just massage and squeeze and pinch the area until the tension just goes. Okay, so this is an important part to release the neck and front leg restrictions and pains. So you got the pecs here, and you want to find about 4 or 5 fingers down from the top in the center line. Press in with your middle finger and feel for a tight band going across, and there's just an edge of the band there, so I'm pressing in quite deep there, and that band, I've got to loosen that band. So just do gentle rocking movements just to loosen the band there. So that'll release tension not only in the chest and the front legs, but all the way up the neck as well. Okay, so that was a position about 4 or 5 fingers down on the center line, and go right in until you feel the band deep inside, and then release that. Good. Hi, okay, we're with Dragon today, and I just wanted to show you if it's got saddle issues or soreness in the back, how to release it. So this area just at the back of the 17th, 18th rib, I find quite a lot of horses, I've got a pain or a bruising or a sensitivity here. So to start with, I'm just warming up the area with the palm of my hand. Just warming it up a little bit. And if that pressure is too much, then it's bruised quite badly, and you really got to be very gentle if it's bruised up. So warm up the area, and then we'll do with the fingers, we'll do movements across the muscle, and then that'll show up where the exact pain is. You'll feel a little lump, and then transfer your thumb and put pressure straight in for 20 seconds to a minute until you feel that that lump just dissolve underneath. And when it goes soft, then just finish off by smoothing the area out again and double check that it's okay. And if when you do the movements then, if there's still a reaction, find the lump, which will be the trigger point, and just squeeze it out. Good. Okay, so we're just going to have a look at Dynamite's hamstrings now. So we're looking from the sit bone down to the hock, and there'll be 2 muscles there, the semimembranosus and the semitendinosus, and going down there can be 2 or 3 different types of 2 or 3 different positions of trigger points going down there in each of the muscles. So you want to find the split between the muscles and gently massage the area. On the outside one, move the tissue outwards, and the inside one, move it inwards. And if there's a reaction from the horse, or you can feel there's some scarring or some knots there, get right in on the knot and just gently work on it. So you can do little clockwise movements, just go in little tiny circles until the area just softens a little bit, and then go back down. You can warm the area up by doing movements with the palm of your hand all the way down the muscles, and then find a split and work across the area all the way down to where it turns into a tendon. And then on the inside, then doesn't matter if you use your fingers or your thumb, a little bit easier to catch those muscles with using all 4 fingers. So from the split between the muscles, press in and do moves inwards, and on the outer muscle you do moves outwards. Okay, and then just warm up the area. So the inner muscle, medial moves, the outer muscle, lateral moves. Okay, and this is lovely and soft on Dynamite. Good. Okay, if we're working on some issues with pain around the hips, this is a good place to start. You can see the tubercoxia there, you've got the bone angling backwards, about 45 degrees. And then if you come forward a bit, feel for any tension underneath. So put your 2 thumbs together and just do some little moves around the muscles there. It's warming them up to start with, and then feeling for any big reactions. And if you find a reaction, just stay on the area and just do little circular moves. And if a horse lifts his leg up like that, that's really good, because you can get in deeper then. Have you finished? Okay. I think he's more interested in what's going on outside. But if we just get a little painful area like that, just work on it. Don't rush it. You can be there for a couple of minutes, just softening the area. And if a horse wants to lift this leg up, that's fine, because you can get in a little bit deeper then. And then I just finish off with the palm of the hand, just warming the area up and making sure that there's no tension inside there, underneath the hips, because you've got some important muscles going through there, the iliacus and the psoas muscles and the abs. And poor performance can come from this area quite often. Okay, thank you. Okay, this is Tramp, and I think perhaps I'll do an introduction now this time. Okay, try again. Okay, this is Tramp, and he's 19, Gypsy Cob, and I'm just going to show you the technique I would use for checking for tension and releasing it underneath the hip bones. So we've got the hip bone there going across at about a 45-degree angle on the tubercoxia there. And if we go forward underneath the hip bone and just have the thumbs together and do a little kneading movement, which will show up any tension. So we get a reaction from the horse, and we're getting a little bit of a tension there. So we'll just stay on that area, connecting with that trigger point, connecting with that tension, and just stay there for 30 seconds to a couple of minutes. And if a horse lifts its leg, that's fine, because you can get in a little bit deeper then. And then release the pressure and work again underneath the hip bones, going up towards the bone. And then if you find a little knot, just stay on there and keep the tension on there. And only go deeper if the horse lets you, like it's taking this pressure off then. So that's perfect then, and you can get nice and deep in there. And you just finish off with the palm of your hand, just warm the area off. And that's good. Okay, so I just want to show you areas of tension at the poll here. We're looking for the atlas bone there, and the wing of atlas, and then the ear and the groove. And if you go along the groove, you'll feel the nuchal ligament, which is a bit like a guitar string, and it's about 2 fingers out from the main. And check both sides. This near side you can check with your thumb, and you can use your fingers the other side, and check them for tension. So the tension should be the same either side, and usually one side is a little bit tighter than the other. So we're a little bit tighter on the off side, so we don't need to turn around. We can just, from here, just gently massage the ligament. Well done. For 20 seconds or a couple of minutes, so however long it takes for the horse to relax. Well done. So we're doing medial moves across the ligament and massaging it a little bit and just getting rid of any tension that's on there. Well done. Was that nice?